Astra's gonna join the video today. So which members of the interprofessional care team provide palliative care or hospice care? So you would have your nurses who could work at nursing home settings, nurses who could work on the hospital floor, nurses who strictly work with hospice patients. So they can go to the nursing home and strictly see the hospice patients there, and they come in and they do their meds and they do their charting and then they leave. Or you could have nurses that go to the hospital settings, or like maybe they already work in the hospital, so they have like a specific number of nurses who just work like strictly in the hospital and stay in the hospital. And then another type of like interprofessional care team members could be nursing aides. So those would be like the aides already working in the nursing homes who go in and reposition the patient or provide oral care or those things. And then you would have like, I know they have care techs now, and I didn't know that hospice had these until I was working as an aide while I was going in my LPN year. But there's actually hospice care techs that come in and they like, not for like end of life care that you think of hospice, but like patients who've been on hospice, let's say like dementia has gotten really bad, but they just are still there. They just can't bathe themselves anymore. So like they come in and give them a shower once a week, hospice does, and just like does an overall check of like that, and then they're just like care techs technically. And then you have your providers, so they write the orders, they write, like update on how things have been going with that patient, changing medications, and also just like providing wishes for the family and those things as well, checking to make sure the patient's not in any pain. And then you have like your pastoral care, so some families really want that to be involved and they have them come visit them all the time, or you just kind of go of what the family needs and what the family picks for kind of pastoral care, but I know that is frequently involved. And then the roles that like nurses plays, they just make sure the patient's comfortable and that they're doing okay, making sure that they're not struggling to breathe, and watching skin breakdown, and just providing also family care and support to the family, because that's a hard process to go through as well. And then the nurses' aides, they just go through and they're making sure the patient's okay. They're doing their daily tasks like repositioning, mouth care, changing them, doing like a bed bath, keeping them kind of okay in a way so that it's not distraught to like the family members to see, and kind of those things. And then physician orders and just making sure the patient's getting what they need and providing accurate care to them and everything. And then just pastoral care, whatever the family believes and wants for that member, as long as like if that patient had their own wishes that they wanted while they were in their end of life process, and kind of involving just everybody working as a team to make sure that those are also dealt with as well.